Okay, so self-diagnosis, does it work? Is it worth doing, or is it hurtful and you should never do it? So this is a tricky topic, and if you are someone who has self-diagnosed with something or identifies with a specific mental health disorder or otherwise, this is not about shaming anyone or saying you should never do it or it's never helpful. This is exploring whether or not it really is helpful to you or to people in general. And should we do this at all, or should we leave it to the professionals? I don't have a clear-cut rule for this, but I'm going to give you some ideas as to what to think about in terms of when it's useful, when it's not useful, should you really use it or not. So I'll start with where it is useful. Where it is useful is it gives you an opportunity to reflect on your experience and relate to other people's experiences. So if it's a diagnosis, it means other people have had it before. If this is a really bewildering situation you're in and you really don't understand why you are feeling or experiencing your life in the way you are now, it might really help to see that, hey, there is a name for this, or people with similar experiences call it that. So that's good because it helps you kind of connect to a framework that's already out there. That's useful. The other thing that's useful is that with that label will be something else like a therapy or a tips as to how to manage it, something like that. And it can be good for someone to say, well, actually, it's not that intense for me. It does seem to be like that for me. I don't want to go to a doctor. I don't want to go to a psychologist to get it formalized. So I'm just going to try the tips. I'm just going to try watching other people who experience it and what they do to manage what they've got going on. ADHD comes to mind, but I won't use that the whole video, but you might think about that because there's a lot of self-diagnosis and increasing diagnoses for that now. If it helps you to use the ADHD label to find books, resources, tips to help you, if that helps, that's great. Do that. It does eventually veer off to something unhelpful, and we'll get to that. But if it helps you relate, if it helps you help yourself, that is a good reason to have a diagnosis. Now, where it doesn't help is where you over-identify with the term. So what does that mean? If you over-explain your behavior and you excuse things that you do with that thing, oh, I have this, so of course I'm doing that. You're basically giving responsibility to the label rather than taking it yourself. So I'd really question, why do I have this label? Why am I putting this label on myself? Is it so that I feel better about the fact that something less than ideal is happening? Because it's just as important to recognize that some people struggle with focusing without saying that they have ADHD. It's a real problem regardless of whether or not you have ADHD. So do you just want the label of ADHD so that you don't have to explain yourself particularly? Because that can be frustrating too. If you say, oh, I really find it difficult to stay on top of things, or I never finish projects or something like that. It's going to be more difficult potentially for people to empathize with that than for you to say, oh, I have ADHD. It seems like I am going to stick to the ADHD label, so that's fine. Let's keep going. So if you're using it to escape something, to escape blame, to escape shame, is that the only way? Is it actually the most effective way? Do you need to subscribe really to this label? Does it really help? And if so, what are the reasons? The other thing is that it can really limit how you think about your experience. So for example, if someone thinks about themselves as a certain personality type, that's not a diagnosis, but just for example, people say, oh, I'm an introvert. And if you say you're an introvert and you tell people you're an introvert and you believe you're an introvert, then I think you're actually more likely to just do things in line with that rather than to appreciate, hey, I tend to be a bit introverted in this way, but I'm more extroverted in that way, or in these situations, or at these times. So what does the label introvert even do for you? Maybe it's a shortcut similar to a diagnosis. Maybe it's a shortcut so people can understand, oh, so this is the collection of things that are going on for you right now. Fair enough. But same with introvert. So with introvert, do you really need that label? Or do you just say, hey, do you know what? I prefer to stay in on weekends. Maybe it can just be as simple as that. If you say I'm an introvert over and over again, you're kind of expecting yourself to adhere to this label in some way or another. And then when someone sees you behaving in a different way and they say, oh, I thought you were an introvert. Do you see? It's just like, what was the reason for it to be there in the first place? Maybe there was never a reason for it to be there. So I'd think about, if you have self-diagnosed, try and think, who is this for? What am I trying to achieve by having this label? Does it actually help me, or is it an excuse for me? Does it help me access help? Am I finding more people or resources that are getting me help, and is it actually helping, or is it just a way of finding a tribe? And finally, why haven't I gone to a professional? That's a huge question. Why haven't you gone to a professional? If you truly believe and you have self-diagnosed, there should be nothing holding you back from getting the diagnosis, really, unless maybe it's frightening or maybe it's unaffordable. Of course, I know there are real barriers to that. But what I'm saying is you may as well formalize, because what would you be missing exactly? What would be the problem with getting a professional who's trained to figure out if people have this thing or not? Why not get it? It will get you formal access to resources, it will get you access to medications or anything that might support you. That's another reason. If you self-diagnose, why didn't you go all the way with a diagnosis? There are many reasons, and I know there are many reasons, so I'm not actually asking you to answer this for me. I'm just saying, if you have it self-diagnosed or you're trying to self-diagnose right now, I would ask you, why not just leave it to a professional to do it for you? I mean, if it's done well, there should be a clearer answer and you'll have more direct access to resources, which is all the benefits really that you were going to get before, all the benefits of the self-diagnosis without the harm in a way. Because here's the harm. If you don't go for an actual diagnosis and you stick to self-diagnosis, you could have made a mistake, you could be masking other problems in the guise of the self-diagnosis you chose because that was the best fit you could figure out. You've now committed to this label and you're not as curious about what else it could be. You also probably don't have any training in the thing that you've self-diagnosed with. So you've put yourself in that predicament by having a lower amount of knowledge about the field. There are professionals out there who will do the diagnosis for you. Why not leave it to them? Again, I already acknowledged the difficulties with obtaining a diagnosis, and I'm fully aware. The reason I'm saying all this is if you're not going to pursue the full diagnosis, why don't you leave the label? Maybe don't self-diagnose. Why not self-explore? Why not self-direct? And if for you right now, self-diagnosis of whatever, bipolar, borderline personality disorder, ADHD, depression, anything like that, if those feel like labels that describe what you're going through, reading, exploring, speaking to people, that's all good. That's all fine. Hearing people's stories who are or have gone through that, all good. If you are actually depressed, you will probably need a diagnosis so you can get proper help for that. If you have ADHD and you're at school, you may need that diagnosis to get the support you need. So it's almost like, why not go the whole way? If you're just exploring what facets of that diagnosis relate to you because they're prominent now, that is fine. But why use the label? Why have you decided to take that label on? I'm being a little bit provocative, I guess, here, but I hope you can see that this is not about me stopping anyone from exploring or from using a label without a professional. It doesn't bother me if you use that label or not. I care more about, is it going to be helpful to you? Is it going to be helpful to you, and is it going to be helpful to others to propagate this idea that you can self-diagnose? Personally, it's not that I don't think you can self-diagnose. I think it's just less useful to self-diagnose. That's my point. Could you figure it out alone? Yeah, maybe. I just think, why though? My question is why. I haven't heard a good reason yet. So if I were in this position, I think what I would do is, if I read a load of books and it helped me just to use what I learned from those to address the thing that I'd self-diagnosed with, I might leave it there and perhaps never use the label because I've addressed it somehow. If it was continuing to create a problem, I might take the self-diagnosis a bit more seriously, but then by doing so, I'm implying that I should go for a diagnosis. So take it to that level. I guess this is another thing you could think about as well. If it's actively causing you trouble in your life now, I don't think a self-diagnosis is enough. If it is causing you a problem and you've been able to remedy it, you've been able to address it by self-diagnosing and then seeking out materials to get help, then good. Then you're back to square one, in a sense. You've used the label to get your own self-help, and then you're adaptive again. You've been able to move on. If you are stuck in that place of not being able to move forwards, and you just want the label to help you feel like you're recognized, that you have a real thing, then I'd say, fine, that's helpful, but you're excusing you're not going for a full diagnosis because you've applied the label yourself. I would say in that case, since you have an enduring issue and it's continuing to cause a problem for you, I think going for a diagnosis is going to benefit you. That's it. I don't think I'm hardline on this. Tell me in the comments if you think I'm being too harsh or whatever. But my point is that I think if you need help, you should help yourself if you can, but there is a limit to that. And if you need more than that, and you've gone to a label just to make yourself feel better about being in that position, then I'd say you'd feel even better by seeking a professional and getting an actual diagnosis. So I'll leave it there for now, but I'm sure this warrants a few more videos, and we'll see how the discussion goes. So let me know what you think in the comments, and I'll see you in the next one. Cool. Look after yourself.